Thank you, Gabrielle. Thank you, Senators Markey and Whitehouse. Thank you, Gas Leaks allies, and all of our allies in the room today. So the gas industry knew more than a half century ago that gas stoves caused dangerous indoor pollution. I mean, think about it. Back when the top song we were listening to was Hey Jude by the Beatles, they knew from scientific studies that gas stoves emitted nitrogen dioxide and that it was harmful to health. What did they do about it? They covered it up, they denied it, and they funded their own research studies to try and contradict the growing research on actual health risks. Today, when we're listening to Beyonce, we have decades of scientific research telling us that gas-burning appliances, your gas stoves, your gas furnace, your gas water heater, etc., not only emit nitrogen dioxide, but also carbon monoxide, particulate matter, formaldehyde, a known carcinogen, benzene, another known carcinogen. These gases are dangerous, especially when they are released directly into your home, into your kitchen, by your gas stove. So let me tell you what happens when you breathe in one of them. I'm going to focus on nitrogen dioxide. Nitrogen dioxide harms several body organs, but the most common effects are those on the respiratory tract. These effects vary from symptoms like coughing, wheezing, and chest tightness, all the way to severe, life-threatening illnesses such as chronic obstructive pulmonary disease, or COPD. Nitrogen dioxide also causes and exacerbates asthma, one of the most common and most costly diseases in the United States. Asthma causes swelling and inflammation of the airways that carry the breath into your lungs, making it rather difficult to breathe. It can be deadly. Everyone's lungs can be hurt, but that risk is not shared equally. Our kids are at particular risk. Their lungs are still developing, they breathe more deeply and more rapidly than adults. They have more lung surface compared to body mass than do adults. So in children, long-term exposure to nitrogen dioxide, as you might get from growing up in a household with a gas stove, can cause new cases of asthma. For kids who already have asthma, even small increases in short-term, low-level exposure can trigger asthma attacks, leading to trips to the emergency room and days lost from school. Poor people are also at risk. For one thing, low-income communities are disproportionately burdened by asthma. Also, if you live in a small house or apartment, you're more likely to be breathing high concentrations of indoor air pollutants from your gas stove. If you're a renter, you're more likely to have older appliances. And if your landlord doesn't maintain your gas stove, your aging gas stove, you're more likely to be exposed to dangerous levels of emissions. And the risk to people with asthma falls disproportionately on African Americans, who are 40% more likely to have asthma than white people, and Black children are 8 times more likely to die from asthma than are white children. So the American Gas Association, the AGA, is not only using our money to lie to us about the health effects of their product, they are also perpetuating dangerous, life-threatening social and environmental injustices. This is wrong, it shouldn't be allowed. Physicians for Social Responsibility calls for the American Gas Association to be held accountable. Thank you. Finally, it's my pleasure to introduce Caleb